Hello and welcome back to my session. We will be talking about jaundice today, and there are two types of jaundice. Like you can have a medical jaundice, all the causes of jaundice. Then you have what we call as a surgical jaundice, which is a type of obstructive jaundice. So we will focus on obstructive jaundice. Jaundice, as we all know, can be pre-hepatic, hepatic, and post-hepatic. So what are the small, in case we go into a small kind of discussion on what will be the causes of jaundice, and that will be like obstructive jaundice will be your intrahepatic and your extrahepatic jaundice. What are the causes of intrahepatic jaundice? That would be either they will be non-obstructive and obstructive. You can have intrahepatic obstructive causes also and non-obstructive causes also. Then there are certain non-obstructive causes. You have viral, you have drug-related this thing. Then you have primary biliary cirrhosis, and also you can see it in pregnancy. You have some kind of non-obstructive jaundice there. Then in obstructive jaundice, it's either stones or cancers, the emboli, the parasitic infections, or the cancerous emboli, which can be present there, can be seen in it. Now, CBD stones are the leading cause of extrahepatic biliary obstructions, and others include bile duct cancer, malignancies such as periampullary and peripancreatic, and benign strictures, including chronic pancreatitis, are all increasingly common in cases of jaundice and the causes of jaundice. And CBD extrahepatic causes of obstructive jaundice, you can have CBD stones, strictures, inflammatory edema, biliary atresia, bile duct injury, tumors, tuberculosis, and also roundworms. So these are the external causes, and there may be certain genetic factors also associated with the production of causation of jaundice. Now, what happens when there is jaundice inside? There is a lack of bile in the intestines, there is a destruction of the intestinal mucosal barrier, and that leads to increased absorption of other endotoxins, which may lead to the increased production of pro-inflammatory cytokines that may lead to systemic immune response syndrome, and finally multiple organ dysfunction syndrome. So that can all result in from either what are the causes we mentioned here, either it's intrahepatic or extrahepatic type of jaundice. We should go into thinking why this is jaundice is such a big problem, because normally the bile is sterile, but what happens in case of obstruction, there is a retrograde flow of microflora inside the biliary channels. Now what happens is that during the obstruction there is a dilatation of the duct, and in this dilatation of the duct then slowly the sinusoids and the capillaries also dilate, and there is a leakage of bile inside these capillaries and dilatation, and this now bilirubin is flowing into the blood, and that is containing the microorganisms which have now entered into the blood. So that ultimately leads to like cholangitis, and that is the causative factor of why we are having infections during bilirubin. So it is basically the entry of microorganisms that occurs during the obstruction that leads to all the features such as bacteremia, then it leads severe infection, sepsis, there's an increased permeability of the tissues there, and then there are bacteriotoxins that start to flow in. So this is basically what is happening. Then what you find there is polymorphonuclear infiltrations and neutrophilic leukocytes into the portal vein, and also there will be fibrin deposition. So this is what is happening basically. Now how does it change the immune systems? It changes the immune system, it changes the coagulation systems, there is an oxidative stress in the gut, and even the kidneys are hemodynamically affected. So basically when we're talking about pathogenesis in case of jaundice, so this is all we need to know beyond just regular stuff when we talk about jaundice. Now, why jaundice becomes problematic? and because then accordingly you have to treat the symptoms as the microorganisms are infiltrating different areas. What you will get is two types of patients, whether they can tolerate surgery or whether they cannot tolerate surgery. So either if they can tolerate surgery, the most likely obstructive release procedure would be a laparoscopic cholecystectomy and biliary tract exploration. And then there's other procedures which have been mentioned is like Roux-en-Y tocojejunostomy and also pancreatoduodenectomy. These are the procedures that are followed in case of surgical management of this thing. Jaundice, in cases patients who are not fit for surgery or do not opt for surgery, then you have cholangiodrainage, then you have PTCD, then you have PTBS, which is biliary stenting, then you have endoscopic nasociliary drainage, then you have endoscopic retrograde biliary drainage, and endoscopic ultrasound biliary drainage. So basically it's the surgical and the non-surgical management. So this is how people are getting treated in surgical jaundice.